Good afternoon, everyone, and we hope you are well. CMI is a premier outpatient clinic located in the heart of BGC. With over 150 specialists and subspecialists on our roster, CMI continues to be here for you and for your medical needs, such as specialist consultations by phone, video, or in person, diagnostic procedures, and preventive treatments such as vaccinations and checkups. No crowds, no queues, no hassle. CMI is the safe clinic for you and all those who are dear to you. Please welcome our speaker, Dr. Geraldine Zamora.
Hello, good afternoon. I'm Dr. Geraldine Zamora, a rheumatology specialist at CMI, and I will be your moderator today. Thank you for joining us in Ask the Experts How to Deal with a Broken Heart and Other Cardiac Diseases with our speaker, Dr. Lauro Abrahan IV, CMI's interventional cardiologist. So with this pandemic going on, our bodies experience a lot of stress and pressure. We may experience some symptoms that we are either unaware of or we take for granted due to fear of going out of our homes to seek for medical help. Our brokenheartedness these difficult months, either metaphorically or literally, may be a call for proper medical advice. So CMI wants to make sure that we provide medical support in any way we can, supporting each other as we continue with our mission of providing premier patient experiences. In today's webinar, our speaker will share with us the common causes and symptoms of heart diseases and why it is important to never ignore our health, especially during these trying times. Before we proceed, just a few reminders. We will mute everyone's microphones and turn off your videos for the duration of this webinar. For any questions, please type them in the chat box or in the social media pages of CMI, and this chat box can be found at the right side of the screen, and then we will group the similar questions and have our speakers cover as much ground as we can. If you have not already done so, it would be great if you can include your full name to help us identify you properly for your questions and for other matters where we might need to reach you. And now, it is my pleasure to introduce our speaker, Dr. Lauro Abrahan IV. He is a practicing interventional cardiology specialist at Centre Medical International in BGC, and he's a diplomate in adult cardiology and was a board top-notcher last 2017. He graduated summa cum laude from UP Diliman MBB course and cum laude from the University of the Philippines College of Medicine, Manila, and completed his residency and fellowship training in adult cardiology and fellowship training in adult interventional cardiology in UP PGH. He is currently a member of the Philippine Society of Cardiac Catheterization and Interventions and the Philippine Heart Association. He has been conferred several awards during the Asian Pacific Society of Cardiology Singapore Scholarship, as well as the Asian Pacific Society of Hypertension Young Investigators Fellowship in Seoul, South Korea, among a remarkable list of international, national, and institutional awards. He has published numerous journals and books and has conducted numerous health talks on cardiology, both inside and outside of the country. Friends, ladies and gentlemen, let us welcome Dr. Lauro Abrahan IV.
Share my slides. Okay. So again, good afternoon. I'd like to thank CMI for the opportunity to speak regarding heart health, especially in these times when people may be a bit apprehensive about going out of their homes to see a doctor. So today I'll be talking about heart disease, and I'd like to be able to hopefully break it down for you in simplified and easily understandable terms. Okay, so we all know the heart's primary biological function. It's supposed to squeeze out blood in order to bring oxygen and nutrients to the other organs of the body. Essentially, the heart is just a specialized pumping muscle, but it has a lot of moving parts that work together to make it function properly. So it's got an electrical system that can short circuit. It has doorways or valves that can get leaky or damaged. It has an outer sac or covering that can get inflamed or can harden. And it has its own blood supply, the coronary arteries, which can get clogged over the years. And we don't have time to cover all of these, so I decided to focus my talk on the most common of heart problems. And these are coronary artery disease and heart failure. And just to give you an idea regarding the gravity of the problem, here are some numbers from 2017 Philippine statistics, with 3 of the top 10 causes of death being linked in some way to the heart and the blood vessels. That's 75,000 deaths that are attributable to a broken heart. So let me first talk about coronary artery disease, or CAD. They're not exactly the same, but some of the other medical terms for this include coronary heart disease, ischemic heart disease, and ischemic cardiomyopathy. When your doctor gives you this diagnosis, he or she is essentially telling you that you have clogged arteries. Or in Tagalog, we may say may bara sa mga ugat ng puso. And this is something that doesn't happen overnight. It actually takes years for plaque to build up in our coronary arteries. These coronaries are the vessels responsible for bringing blood and oxygen to the heart's own muscle. As fat and cholesterol and other debris deposit on the vessel walls, it gets harder and harder for blood to pass through. And at a critical point, the blood supply will be unable to meet the heart's demands, and this leads to ischemia. The patient will start feeling angina, which is just a fancy doctor word for chest pain. Later on, I'll discuss further how the plaque can lead to a heart attack, but one common question that my patients have is, where did I get this? And this is where coronary risk factors come in. These are certain characteristics in a patient that increase the likelihood of having coronary artery disease or a heart attack. A few of them, such as these 3, are what we call non-modifiable. So to put it bluntly, wala na tayong magagawa sa mga risk factors na ito. These are things that we were born into or things that we cannot control or reverse. On the other hand, we have the modifiable risk factors, and these are the conditions that your doctor will want to monitor and get on top of. So these include high blood pressure, high blood sugar, and high cholesterol levels. Quitting smoking, exercising more, and eating healthy to avoid being on the heavy side, and learning coping mechanisms to deal with stress are also some personal choices that we can make to decrease our risk of heart disease. So when a patient comes in complaining of chest pain, one of the things that we doctors have to figure out is if this is stable angina or unstable angina. So with stable angina, the chest heaviness or discomfort usually lasts less than 15 to 20 minutes tops, and it only happens once in a while when the heart is usually beating faster and is under more stress, such as during physical activity or during exercise. If you're having episodes of chest pain, please do seek consult with a cardiologist or a specialist of internal medicine. Now, if you notice your chest pain attacks becoming more frequent, or if it's taking longer to resolve or happening even at rest, then you might be having unstable angina. And I cannot stress this enough because this may be the beginning of a heart attack, which I will get to in just a bit. If your doctor suspects that you have CAD or coronary artery disease, one of the tests that you can expect is an ECG or an electrocardiogram. So there are several electrodes or chest and on your chest and limbs. These are small suction cups attached, and a printout is generated. So it may just look like a bunch of squiggly lines, but these lines can actually help us determine how serious your chest pain is or what type of heart attack you're having. Sometimes a run-of-the-mill ECG may appear normal because it's usually taken at rest while the patient is lying down. So it's only when the patient is exercising and the heart is beating faster that certain abnormalities may appear. So for this reason, your doctor may order a more specialized test called the treadmill stress test, wherein you basically have an ECG attached to you the whole time that you are walking or jogging on a treadmill. So there are actually several variations to this protocol, and it can be adjusted depending on what the patient can do in terms of exercise or what the doctor wants to obtain or see from the test. There are also some patients with coronary artery disease who do not complain of chest pain, but have symptoms of heart failure. And this is when the heart muscle weakens, most commonly due to clogged coronaries, and is unable to pump effectively to give blood to the other areas of the body. This causes a buildup of pressure and fluid in the tiny air sacs of the lungs and eventually gets transmitted to our legs and feet. So what are the symptoms? You can have shortness of breath on exertion, or it's sometimes more noticeable when you need more pillows under your head at night because you cannot tolerate lying flat on bed. Others tend to feel their exercise capacity going down. Dati kayang-kaya mag-golf or mag-zumba. Ngayon, nagsisimula pa lang yung game or yung routine, hinihingal na. Okay? There are those who tend to retain fluid, and this can lead to abrupt weight gain, something as subtle as abrupt weight gain, or something more obvious such as swollen feet or legs. So one important test that is requested for patients with suspected heart failure is the 2D echo. And this is essentially a heart ultrasound. Okay, so this clip shows a normal, healthy heart with well-coordinated and strong pumping capacity. No? Compare this with a deceased, failing heart, okay, which is larger than normal and has very weak contractions. The movement of blood in the chambers is so slow that some blood has already started to clot here, as encircled in red. Okay, so I already touched on this earlier, but we're now moving into what I think is probably the most important part of this webinar, because this is the diagnosis that is an emergency. So what we doctors call a myocardial infarction or acute coronary syndrome, and what people commonly know as the heart attack. So it's an emergency because heart muscle or tissue can end up dying if we don't seek help immediately. We already mentioned ischemia earlier, but if the ischemia is severe or long enough, then that part of the heart muscle supplied by the blocked coronary can no longer be saved. So this looks familiar from our earlier discussions. This plaque has been building up from years of bad habits like smoking, unhealthy diet, lack of exercise. It's causing restriction in the blood flow through the coronary and is probably causing some stable angina for the patient. But what happens if this plaque ruptures? Okay, the inflammation in the area ends up attracting blood cells. Okay, this causes formation of a clot, a blood clot, and this clot can then get bigger and bigger in a matter of minutes or hours. And eventually this can sometimes cause complete obstruction. With the cutoff of blood supply and oxygen, that part of the heart muscle can die if flow is not restored immediately. So it's important to be able to know the warning signs of a heart attack. Okay, chest pain is still the most common symptom, and we already described the features of unstable angina earlier. So chest pain episodes getting more frequent, lasting longer, happening even at rest, or not relieved by rest. Okay, so the chest pain can actually be accompanied by shortness of breath or vomiting. Some patients, they feel very anxious and have cold sweats. No? They describe a sense of impending doom, parang mamamatay na sila. Okay, so if blood pressure drops or heart rate gets too slow, one can also feel dizzy and may even faint or lose consciousness. Okay, we are already somewhat familiar with the ECG and the 2D echo, but for heart attack patients, when heart muscle dies, it ends up releasing small proteins called troponins into our bloodstream, and we can detect this using blood tests. So this also helps us in our diagnosis of a heart attack or a myocardial infarction for patients who come in. And even with just 20 minutes of total occlusion, there is already irreversible damage happening at the microscopic level. So the goal is to restore blood flow as soon as possible. And the longer you wait, the more cardiac tissue is potentially lost. Sayang yung heart muscle na pwede pa sanang masave. Okay? So how do we open up blocked coronaries? Okay, so there are actually several ways. The first one is to use clot buster medications, which are given through an IV line. So how does this work? The drug basically acts by disrupting the mesh network that holds a blood clot together. And this effectively dissolves the clot. Okay. This method actually works best if the clot buster is administered within the first 3 hours of the onset of a heart attack. So that's why it's very important to act quickly. Okay. Notable side effect, however, is the risk for bleeding. And patients with a high risk of bleeding, okay, are not good candidates for this approach. But it can be very effective, as you can see in this picture, if given early. Okay, so the amount of infarcted or dead tissue is hopefully reduced, and you're able to save more heart muscle. Now, in larger hospitals and tertiary centers, there are cath labs. So in cath labs, it's like a mini operating room where we can do emergency angioplasty and stenting. Some of you may be familiar with this. Some of you may have already undergone this. Okay, you do emergency angioplasty and stenting. So in this procedure, a metal cylinder, it's a small metal cylinder, it's tunneled through the blocked coronary artery. Okay, a balloon expands and pushes the metallic stent against the plaque deposits, effectively crushing it against the vessel wall. And when the balloon is deflated and pulled out, okay, the stent is left in place and serves as the support to keep the coronary open. Okay, this is a minimally invasive procedure. Okay, it's not a major operation in the sense that you will be cut open. Okay, they're actually just small entry points. We choose to either go through the wrist or the groin area. Okay, and assuming the procedure is a success, recovery period is pretty fast, along the lines of a few days. And if you're wondering how small a stent is, it can actually be held between the tips of your fingers. No? So this is what goes into the coronaries. This is what is left inside your coronaries to help keep them open for a much longer period of time. Now, I just want to give you a before and after shot as an example. This is one of our patients who came in with a STEMI, STEMI, which is actually the most serious kind of heart attack. And fortunately, he came in relatively early, within 2 hours of the onset of chest pain. Okay, and a stent was placed here at where the red arrow is pointing. So there's complete occlusion at that point, resulting in restoration of the coronary blood flow. So now you see what the vessel was supposed to look like if blood flow was not restricted or blocked. Okay, so there was no more recurrence of chest pain afterwards, and I was able to send him home after, around 3 days after the procedure. Sorry, let me just reopen the PowerPoint. Okay, sorry. So we're talking about stenting and angioplasty. Now there's a third option. So if the blockages involve several vessels or the blockages are too difficult to stent, a coronary bypass surgery may be more suitable. No? So the surgeon uses pre-existing branches like this one, okay, or veins from the legs like this one to build bypass bridges that will get past these blockages. No? My usual analogy for patients is that if a stent is a tunnel, then a bypass surgery would be something like making use of flyover vessels. No? So this option, however, is open chest and open heart surgery, and thus requires a longer recovery period, usually lasting at least 1 week in the hospital. So we mentioned earlier that constant exposure to a stressful lifestyle, a stressful job, or even a stressful relationship can be a risk factor for the development of coronary artery disease. There is an actual disease entity, however, wherein stress is the immediate trigger for the heart to become dysfunctional. And this is known as broken heart syndrome or Takotsubo cardiomyopathy, Takotsubo syndrome. It was first described in Japan in 1990. So certain tragic events such as the death of a loved one, losing one's job, or even this whole COVID pandemic, this COVID situation can bring about a decline in the pumping capacity of the heart. And while the signs and symptoms can very much look like a heart attack, no, the coronary arteries do not have significant obstruction or occlusion in them. Clinicians are thinking that it is the surge of stress hormones, particularly adrenaline, that causes the heart to deteriorate transiently. Okay, so fortunately, most patients are able to recover normal heart function after a number of weeks or months. The syndrome is actually named after the Japanese word for the trap used by Japanese fishermen to catch or to capture octopi or the octopus. No, so the beating heart assumes a shape that resembles this pot with a narrow neck and a wide rounded base. Okay, so this is just an interesting phenomenon. So it's not all about physical factors. Sometimes stress or emotion can be a trigger. Now, these last few slides will just be spent on some useful health tips. Okay, as they always say, prevention is still better than cure. So, ang isa pang favorite question ng mga patients is, Doc, ano po bang bawal na pagkain? Okay? So, in the Pinggang Pinoy, no, or the healthy food plate for Filipinos that is endorsed by our own Department of Health, you'll see that half of one's plate should actually consist of glow foods, no, like your fruits and vegetables. Carbs like rice can make up around 1/3. And then we have a small percentage, around 17% for protein. So this is preferably fish instead of red meats. So we should try to avoid fried fatty foods. So fast food usually falls under this category. Excessive salt is also not good, especially for those with high blood pressure. Red meat intake is also increased, leading to increased uric acid levels and gout. No? And then there are the sugary or sugar-sweetened beverages. Okay? And kasama dito, not only the usual iced tea, soft drinks, but also yung favorite for most people right now, yung mga milk tea. So believe it or not, one serving of brown sugar boba milk tea actually has 18 teaspoons of sugar in it. Okay? So this one naman is the 52-100 advocacy. So this is one of our advocacies on the Philippine Heart Association. So basically, each of the numbers stand for something. You're supposed to have at least 5 servings of fruits and vegetables per day. The 2 is has 2 meanings. No? So you usually try to limit your added salt per day to just 2 grams. That's about 2 teaspoons. Okay? You can use naman salt during cooking. But as Filipinos, mahilig po tayo sa mga sauces na yung mga sausawan, yung mga patis, soy sauce. No? So these are the things that we try to avoid. Added salt at the table na. Okay, just use the salt during cooking, the cooking process. And then try to limit your screen time in order to avoid a sedentary lifestyle to just 2 hours per day. Okay, and instead try to get in 1 hour of exercise per day. Okay, for the American Heart Association, they actually recommend 150 minutes per week. Okay, so that's moderate intensity exercise. But actually, for us cardiologists, any activity is better than none. Okay, so even just standing up to get out of your chair, if you're stuck with a desk job, that's better than doing nothing. Okay, and just sitting there the whole day and staring at the computer screen the whole day. And then the 2 zeros is for zero smoking and zero sugar drinks. Okay, as we mentioned earlier. Now there are a lot of resources online. Okay, I'm sure that if you just take the time, okay, you will find a lot of information. But one thing that we can offer you, our associations were able to come up with this app. Okay, so this is an app that is useful for both doctors and frontliners and the patients. Okay, for the patients, it's particularly the information side of it. Okay, so you can download this from the STEMI Consult app. Is available on both your Apple stores and your Google Play. Okay, and it can show you some information in both English and Filipino about the heart attack. And then for doctors, it's particularly useful because it can help you refer a patient who has need for angioplasty to those hospitals that have cath labs that can actually give that service. Okay, so if your patient is not doing so good, needs the procedure urgently or emergently, then this is one way wherein they can track which hospitals are nearest their center if their center cannot do it, and facilitate transport or transfer of the patient to that hospital. Okay, so this is actually my last slide, and I hope I was able to help you understand regarding some of the more common diseases that we face for the cardiologists and our patients. And I'm happy to accept any questions.
Okay. There you go. Thank you so much, Dr. Lauro Abrahan IV, for your very enlightening talk. And now we're opening the floor for some questions. And we do have some questions ready from the audience. One is from an anonymous attendee. Um, he or she is 32 years old and heart disease or clogged coronary arteries and hypertension runs in her or his family. So what specific things can this person do to stay healthy and to avoid heart disease in the future?
Okay. So we already tackled some of those earlier. So basically, it's eating healthy. We mentioned increasing the amount of fruits and vegetables in your diet. Okay, so the slide earlier regarding pinggang Pinoy. Okay, so in your plate, it's supposed to be at least 50% per meal. That's the ideal. No, I know it's difficult to pull off given our current lifestyle and sometimes the unavailability of more healthy food options. No? But that's the more ideal setting. Also, to put in the exercise and get screened for certain diseases as much as possible. No? So since it runs in your family, they actually recommend the American associations. They recommend screening for cholesterol levels as early as 20 years old. Okay, but it can be even earlier if you have a family history. Okay, and then for blood sugar, they recommend it at age 45. No, again earlier if you have any of the risk factors. Okay, if you have a significant family history, if you're more on the heavy side or the overweight side. Okay, so these are some risk factors.
Okay, what about checking the blood pressure? As early as how old should we check the blood pressure? Because you mentioned that it's actually reasonable to start checking the cholesterol levels at age 20 and sugars at age 45 or earlier if they have a significant family history. What about blood pressure, Dr. Abrahan?
Okay, so for blood pressure, the recommended age is usually at the age of 30. Okay.
Okay.
Again, if there's a significant family history, we try to recommend earlier screening as well. Okay, because there are some patients who can actually present with earlier signs of hypertension or high blood pressure, and these patients usually have an identifiable cause that can be pinpointed or remedied, so that you don't have to take maintenance drugs for the hypertension. Because the common form of hypertension that usually happens with age, as we age, this is the form of hypertension that we usually give maintenance medications for. This is primary hypertension. Okay, so this is hypertension that by the age of 70 or 80, around 80% of us will usually have. Okay, but there are some rarer forms of hypertension, what we call secondary hypertension, that can be due to any number of causes. It can be from hormonal causes, thyroid problems. No, these can cause secondary hypertension that if you eliminate the cause of the hypertension, then you don't need to give maintenance medications. Okay, sometimes they'll require some other form of therapy, like maybe surgery or some other medications that will control the organ that is not functioning properly.
Okay, and then you did mention that it can happen in younger individuals. So like in my field, if a patient has lupus or some vasculitis diseases, they can manifest with hypertension, but controlling the primary problem will also control the blood pressure issues of the patient. So Doc, you mentioned better diet, yung pinggang Pinoy, less salt. How much salt is allowed? Like ilang teaspoon? Meron bang ganon? Is it possible
So,
to
and as part of the 50 to 100 advocacy, so yung 2 doon, aside from meaning less 2 hours of screen time, it also means 2 grams of added salt, limited to 2 grams of added salt. That's usually just 2 teaspoons per day na added salt. Okay,
for the
so
whole day? Okay.
whole day.
So when we
This is
fry and we
especially true for our hypertensive patients or those with high blood pressure, because where there is salt, that's also where the water goes, and the increased water or fluid retention can actually increase one's blood pressure.
Okay, but for people without hypertension, is there a limit to the salt intake? Because if we eat, fries or whatever, di ba? Lagay ng salt, we dip it in soy sauce. So I think those are the hidden salt intake, yung mga tago that we have to be more conscious about.
Mm-hmm. Yes, for non-hypertensive individuals, we're a bit more lenient. Okay, but in general, yeah, we generally tell them the same thing, 2 grams, but it's not that strict compared to our more hypertensive
Hypertensive
patients.
patients. Okay, so there's a question. Can a significant change in diet, such as a plant-based diet, in conjunction with increased exercise, help reverse heart disease, or is it possible to unblock a clogged artery or arteries?
Okay. If the blockages are already there in your coronaries, it will be a bit difficult to reverse that. Okay, because as I mentioned earlier in the lecture, it took years for those plaques to deposit on the vessel walls. Okay, so even if you do try to reverse certain habits like smoking or even altering your diet, okay, you can probably at the most prevent further narrowing of your arteries or further deposits of plaque. Okay, but to reverse it, it probably will not be as easy to do so. They have some of our cholesterol lowering medications can help in that aspect, but even then, they don't really go back to normal. They just help in the regression or the to reverse some of it, but it doesn't go back to 100% normal. Still,
Okay.
we still encourage these healthy changes, no, just to prevent further increase in the risk. Okay.
Okay, so it's not entirely possible to unblock it, but we can prevent progression. Kasi
Yes.
if it's already 50% blocked, you want to keep the 50% of your arterial space pattern. Okay, there's a question again. Are persons or people with high blood pressure in the risk zone for COVID, for having this COVID-19 disease? And can you explain why?
Yes. So actually, people who have hypertension, any of the comorbids usually. So these include your hypertension, patients who have diabetes, patients who have asthma or even emphysema, patients who also are also on the obese side, no, especially the younger patients who don't have anything else but they're just on the heavy side. All of these are risk factors that help to lower the immune system, no. So not only does it jeopardize our heart health, it also weakens the immune system. So it's not yet completely understood because, as you know, COVID-19 is still an evolving pandemic, but it is hypothesized that these diseases help to lower our natural immune system, no, and our immune system to fight off COVID. It is early on in the pandemic, though there was an issue regarding drinking certain medications. These medications include those that are for high blood or hypertension. Okay, and there was a concern that if you are drinking certain medications for high blood pressure, okay, such as your enalapril or your losartan, these might make you more susceptible to COVID because it helps to facilitate virus entry into the cell. This was later found out to not be fully supported yet. There was no definite evidence for this. So our stand for that was to still continue taking your antihypertensives or you're taking your blood pressure medications unless otherwise advised by your doctor. Okay, so we didn't want to scare people off into not taking their meds. We still emphasize that the risk of high blood pressure as a risk factor for heart attack and stroke is still higher, no? And the benefits of drinking those meds and keeping your blood pressure under control was still uh, the better thing to do.
Okay, so I think at this point it's important to emphasize that hypertension is one of our silent killers, di ba?
Yes.
You don't usually feel anything when you have hypertension. So I'd like also to take this opportunity to debunk a common myth that, di ba, doc, they always say, or some people say that they know that they have high blood pressure kung masakit na yung batok. But it's not always the case, right? Not everybody with hypertension will have painful nips. And some patients actually say na they stop their medicines if wala silang nararamdaman. But that is not really the right way to go about it because usually blood pressure medicines, when they're given to you, they're meant to be taken for a long time. So it's not something that you can feel iba na yung chest pain from a heart disease and iba yung risk factor lang of having hypertension.
Yes, that's true. So
So,
I always emphasize that to my patients, no, important pa rin yung process of monitoring your blood pressure even if you're on the medications. Because sometimes, even if you're initially controlled already on this medication, as you get older, or if you change certain aspects of your lifestyle, sometimes your blood pressure control worsens again, no? And sometimes we will have to add an additional medication or maybe increase the dose of your current meds, no? So I always tell patients na this is your investment na for your health. Kasi it's really hard to get a heart attack or a stroke. It becomes very debilitating. If it's a serious attack, then it can even lead to death, unfortunately. And now that the hospitals are jam-packed with COVID patients, it's very hard to get hospitalized, okay? Because of all the requirements for having a negative swab, and even if while you're waiting for the swab, you get grouped together with the suspects or the other people in the holding area. So it's really better to try to stay healthy during these, especially during these times na napakahirap ma-hospital.
yes, so yun. It's really important to continue the medicines your doctors give you as long as it's been explained to you what these are for. So going back to diet, there are two questions that I can group again. So is red wine good for the heart? And how much is allowed, I guess, per day?
Yes. For red wine, we do have some studies supporting its beneficial effects for heart health. No, so for women, it's one glass per day is acceptable, and for men, two glasses.
So it depends on the size of the glasses, doc, di ba?
Yes, yung
So depends.
standard wine glass naman.
So is it better not to drink wine? Or is it better to drink wine for the heart? Is it just a better alternative than all the other alcoholic drinks?
Everything naman in moderation, but if we were to siguro pick an alcoholic drink, then wine would be the better choice compared to beer, no, which is a bit fattening, and
Has a
the
lot
hard
of sugar.
and also a lot of sugar, and the harder drinks, no, yung mga gin and rum. So wine is probably the healthiest option among the.
But would you recommend it? Would you tell a patient you drink red wine or hindi? Is it still better without it?
And if you're not currently drinking, I don't recommend starting.
Yes.
If you're already drinking, then I just advise to moderate to the recommended amounts, as I mentioned earlier. Pero yung i-advise ko to drink red wine
The
actively,
heart. So it's not.
oh, I
I
don't.
just want to make sure that the audience understands. And would you recommend slow juicing as an alternative to eating fruits and vegetables to keep healthy?
I'm not super familiar with the process of slow juicing and what goes into it, but for us doctors, we always advise our patients that it's better to eat the actual thing, so the actual fruit or the actual vegetable, compared to having commercially prepared canned drinks, no, yung mga canned fruit juice. These already have certain additives or even certain preservatives that may not be entirely healthy for us, no. So it's better to actually eat the actual fruit or vegetable, no. Of
But if
course,
you were to juice it yourself,
yeah, if you were to juice it yourself, that's better, no. If ikaw mismo yung magpipiga nung calamansi or orange, no. So those are better, no. So you just try to limit siguro yung ina-add nyo na sugar, because again, this would qualify as a sugary beverage na if you add too much sugar, no.
although if I were to add to that, I think eating fruits and vegetables compared to juicing would increase the fiber content.
Yes, so
I
that's
mean,
also
the fruit and the vegetable, if you eat it, you're also going to eat the fiber.
fiber. Yes, so it's
Dietary fiber is good
good for more for the gastric
for the digestion. What about, they say that you have to have a lot of fiber in the diet, yung dietary fiber, to help beat heart disease. There are two kinds of fiber, right? The soluble and insoluble.
Mhm.
And the soluble one is supposedly something that we need for the heart, and the insoluble ones are what we need for the gut.
Mhm.
So
Yes. So for some of our elderly patients, they prefer to take these fiber supplements. Ako personally, I do not advise against it naman, no? So it's usually it's a substance naman that will usually not interact with most of the medications. So for me, if the patient feels that he or she needs the fiber supplements, then that's okay with me.
Okay. Doc, can poor oral hygiene lead to endocarditis? Siguro you can first explain to the audience what endocarditis is
So
and
for
answer
those
the question of
who
this.
have endocarditis, this is basically, so I mentioned earlier that there are valves or doorways between certain chambers of the four chambers of the heart, no? So meron mga valves dyan. Meron kang aortic valve, mitral valve, pulmonic valve, and tricuspid valve. So those four valves can all have infection, no? So if you have certain microorganisms or bacteria that seed from somewhere else, they get into your bloodstream, okay, they can end up landing on those valves, no? Especially if those valves are diseased, no? So if these valves are already damaged from rheumatic heart disease, no, or they are kind of leaky, no, they're not closing properly, they are perfect substrates for these bacteria to get into the lining of these valves, no, and that's what you call endocarditis. So to answer the question, yes, poor dental hygiene is a risk factor kasi the actually the oral cavity or your mouth is dirty by its very nature, no. So if we do not have proper dental hygiene, tapos maraming cavities, this can eventually seed or get into the bloodstream, and then the bloodstream will carry it into the interior of the heart where it can land on your valves. Okay, so actually for patients who have rheumatic heart disease, we actually advocate dental hygiene as well. And if certain valves need replacement through an open heart surgery, we also always ask for dental clearance kasi we need to make sure na walang bacteria from the teeth or the cavities that can infect the new valve that we're going to put in, because it's a very expensive valve, it's a very expensive material, and the operation itself is also very costly. Sayang naman if we have to take out the valve just because it got infected because of poor dental hygiene.
Okay, sige. Doc, have you encountered a case of Takotsubo disease in the Philippines?
Yes, actually, that clip we showed earlier, that was one of our patients. She was actually an 81-year-old female. So hindi siya emotional stress or tragic event. She was more of had a severe infection that she was
Mm.
fighting, and the heart was eventually affected because of the stress hormones released during the fight against the infectious process. So
So,
yun. But
okay. So,
her coronary, I didn't show it anymore, no, but her coronaries did not have any narrowing or
plaques.
obstruction. So it was really just the muscle that was affected, and eventually she was able to recover naman.
So, even with age, it's not normal for everybody to have plaques. Or not everybody who's older or not everybody who will become older will have heart disease. That's why we still have time, no?
Yeah.
Hopefully, our audience will remember this important thing. We have to start becoming healthy, and if we're already healthy, then let's continue becoming healthy, because it's really possible to live a very long and healthy life. As they say, no, when you live, it's you want to live, you add years to your life rather than just adding life to tama ba? Adding life to those years rather than just adding years to your life. Yan. So if you don't have a stroke, you don't have a heart attack, then it's possible to live a very full life. This attendee says that her normal, I'm assuming she's a female, her normal blood pressure is 90/70 or 90/60. Or pag mas mababa or mas mataas, nahihilo daw siya.
Hmm.
Siguro what's a normal blood pressure, by the way, for our
Okay.
audience?
So the usual blood pressure, the first number is called systolic blood pressure, and the second number is called diastolic blood pressure. So for the first number, the range should be from 90 to 120. Okay, and then for the second number, it's actually 60 to 80. So 90/60 is actually still within the normal range. It's just on the low side of the normal range. So that's why when you're lower than that, nahihilo ka talaga. Okay? And siguro if your body is not used to higher blood pressure levels, then that will also be manifesting as dizziness in some patients.
But it's still better for her to have herself checked because dizziness has many causes. It can
Yes.
be from your brain. It's not just because of the blood pressure. It could be from other conditions. No, uh, corollary to that, for senior citizens, how true is it that standard blood pressure of 120 over 70 no longer applies? Is it true that as one grows older, ang acceptable blood pressure, maybe systolic blood pressure, is 130 to 150? Is
Okay.
this
So for patients who already have hypertension, I usually the recommended target is to try to bring it below 130. Okay. But it is true that for elderly patients, I'm a bit more lenient. I usually target below 140 or even below 150. Okay, so this is because it's harder for these patients, these elderly patients, to be able to tell you if they're feeling dizzy. No, sometimes they end up getting up from bed and then they get dizzy because your blood pressure medications are a bit too much in dose, overdose na kumbaga for their age, no, and they end up getting dizzy and then they end up falling and suffering a fracture or even worse, a head concussion or a bleed inside the head, no. So to avoid problems like that, we cardiologists in general, we're trying to be a bit more lenient for the elderly population, no? So those in the advanced age category, usually pag above 60 or 70, yun, I'm a bit more lenient po in terms of controlling the blood pressure. But for the younger patients, so yung mga 30 pa lang or 40 pa lang, high blood na, yun, these are the patients that I try to be more aggressive talaga. I try to really bring it down to less than 130 or even less than the 120, no? Talagang into the normal range ko sila tinatry ibalik. Kasi they still have a relatively longer lifespan ahead of them, so I want them to be able to enjoy those 3 years, no, of their life.
Yes, we have to emphasize also at this point that if your blood pressure is always high, it it also leads to damage in your kidneys, no? So brain, heart,
That
kidneys.
far-reaching implications, no, in terms of the consequences to the organs that can be affected, no. So this includes possibility of a heart attack, possibility of having a stroke, okay, getting some damage to your kidneys over time, no. Eventually, if you do not control the blood pressure, you can end up having to require dialysis, no. So dialysis naman is something that the renal or the nephrologist can handle, no. But of course, it's still something that affects your quality of life kasi you have to do it twice to three times a week. So nakakapagod din, and of course added cost, no. So which
Yes,
could be spent on something else, or your time could be spent better doing something else, something more productive.
especially during this pandemic, it's really harder for our patients on dialysis to find dialysis centers, which are either COVID for COVID lang or for non-COVID.
My nephrologist friends, they always complain na
Mm,
uh,
there's delay.
for COVID patients, they really have to be negative, strict yung mga dialysis centers. Even for our patients in PGH and in St. Luke's, na discharge na sila kasi recovered na sila. But sometimes, di ba, the swab kasi can still remain positive even 8 weeks after the illness or the recovery. So these patients, they have a hard time proving na recovered na sila kasi positive pa rin yung swab nila, but clinically
Mm.
already.
Oh,
So mahirap talaga with the current
yes, that's why
pandemic.
we really have to prevent end organ damage. And this is by improving our blood pressure, cholesterol levels, etc. So, Doc, are there better indicators of heart health, aside from the usual LDL, HDL, triglyceride? Are there emerging blood chem indicators that we are using today?
Yes, there are other tests that we can use, no. So for blood test, there's what we call CRP, or high sensitivity CRP. This is C-reactive protein. There are actually some studies that show that even if your LDL levels are normal or not that high, but you have a high level of HSCRP, or high sensitivity CRP, you would still benefit from taking certain medications like medications that lower cholesterol, no? So your statins. Sometimes for heart failure patients, we order what we call the BNP or the pro BNP. So these markers are also blood tests. These are basically hormones that are released in response to a heart that is getting larger, no, or enlarging or having heart failure. So there are studies that show that if you are able to better control your heart failure, the levels of these tests go down, your BNP and your NT-proBNP. So
Okay.
the others are still in the experimental phase. They're not um, in routine use. So we still stick to those that are already established, no, until we get further evidence that these new tests are actually more cost effective. Medyo mahal kasi these new tests eh. When we already have existing tests that are more affordable and more cost effective.
Okay. There are several questions here I can lump together. But first, how often or how frequently should people on maintenance medicines see their cardiologist? Siguro you can broach onto the topic of teleconsultations here, no? Do they really have to physically visit their cardiologist or their other doctors?
Okay, so if your cardiologist is actually a bit on the techie side or tech savvy, he can arrange for teleconsults. In terms of the frequency, it really depends on your symptoms, what you're currently feeling, no, your current status, the current control that you have over your risk factors like your blood pressure, your blood sugar, your cholesterol. Okay, so these are things that we look at whenever the patient comes in for a checkup. So if I see, ako personally, if I see my patient having relatively good control of these factors already, I can usually make the spacing for checkups a bit longer. No? So sometimes when I initially see them, I ask them to come back after 2 weeks. And then if it's okay, I space it out to a month, every month, and then every 3 months, then every 6 months. This is assuming that yun nga, everything is under control. They're not feeling anything new. No new event happened like a stroke or a heart attack. No, uh, these are the things that we look at. So if you're doing relatively well, every 3 to 6 months is fine actually. No, and even if there are some things that need to be corrected or need to be controlled by in your risk factors, these can be done naman usually online. No, so what I usually tell my patients is I send them lab requests and then they have it done. Okay, and then I just do it, especially for patients who are already known to me, no, yung matagal ko ng patient. So, yun, medyo kilala ko na sila. No, it's a bit harder for new patients because we have never seen you before. It's hard for us to examine you through teleconsult, no? Kasi we cannot use our stethoscopes to actually listen to your heart, listen to your lungs. No, we can only inspect certain body features, no? So yung neck niyo makikita namin, no? And maybe if there's swelling in the feet kasi I mentioned earlier the possibility of heart failure manifesting as leg swelling, no? Or feet swelling. Pero yun, if you're really afraid to go out because of the fear of COVID, then teleconsult is a viable option, especially if you're already an old patient or a follow-up patient to a cardiologist that you're already close with.
Okay, so that also answers this question if they should just delay their health checks. So we suggest for you not to do that because there's already a lot of what we call collateral mortality
Yes.
from COVID. We don't want to die from COVID, but at the same time, we don't want to disregard our pre-existing health conditions, which we might succumb from in first, no?
This is
So
why I touched on this earlier regarding distinguishing between stable chest pain or stable angina and unstable angina. So if you're stable angina, you have some time, but you still need to consult a cardiologist. Maybe if you want through teleconsult na lang. But for the unstable angina, yun yung talagang kailangan ng emergency kasi nga, this could be a beginning heart attack. Okay, and we actually noticed, no, ever since March, talagang nag-drop our census for heart attack patients, no? And it's not because nobody's having a heart attack anymore, but because people are so afraid to go to the hospital that they end up just suffering through the heart attack at home. Some of them end up, again, unfortunately, even dying, no? So mag-message na lang yung relative sa amin na wala na po siya, doc. So, sayang, no? Kasi COVID is not just the only disease that needs attention at this time. We still have patients who have heart disease. We still have patients who have other problems. We still have patients who have cancer who need to get operated on. And we're really trying our best to coordinate services for the hospital, not just to cater to COVID patients, but also the non-COVID patients who also need our care, no? And that's something CMI can offer you, no, as an outpatient
As a
clinic.
concierge clinic, yes, an outpatient
It's
clinic.
a standalone clinic and not in a hospital setting, no? So we're very
Okay.
diligent naman with the protocols.
Sige. So there were several questions here about edema, and you just mentioned edema again. Yung isa, she was hospitalized for pneumonia for 3 weeks, and now she has edema. What can she do to make this disappear? I guess, of course, we have to find out the cause of the edema. And then there are two more here. So what can she do? While I look for the two questions I saw with edema.
Okay, so she had pneumonia and now she has leg swelling, no?
She was admitted for 3 weeks for antibiotics.
Okay, so it could be anything.
So we have to find out what it is, what's causing it.
Information. So the first thing I would say is, of course, to siguro seek consult nga. If
Yes.
not a physical face-to-face consult, then siguro teleconsult will do, just to get a cursory idea for the
Yes.
doctor. You know? But it could be anything. Edema is not necessarily just a heart failure problem. It can be a kidney problem. It can also be a liver problem. No, it can be malnutrition. No, so marami talagang possible causes, and it's hard just from a few phrases or a few descriptions from the patient. No? So it helps with teleconsult. We're a bit more reliant on lab exams kasi hindi nga namin kayo ma-examine physically, especially if you are a new teleconsult. But hopefully the labs will be able to tell us more, give us a better idea. So,
Yes.
yun.
Okay. So this other attendee says that her grandma, 85-year-old grandma, had angioplasty.
Mm-hmm.
And now has swollen feet and legs, so edema. Is this a red flag for anything? So she still has some issues with high and low blood pressure, which they manage with maintenance meds. So is swollen leg and feet a red flag post angioplasty, after angioplasty, and how can she better care for her grandma in general?
Okay. So for leg swelling kasi we usually give what we call diuretics or water pills, no. So these are the medications, yung mga furosemides or Lasix that you hear about, that help you urinate more or pee more in order to eliminate the fluid. So that's one possible remedy, although it's just a way to control the symptom. We're not really sure yet why there is new edema even after angioplasty. So sometimes kasi even with the advances in the technology that we use in the stent, even with the stent, there have been a lot of advances in terms of the construction of stent that we use to open up the arteries. But unfortunately, even with these advances over time, no, over several years, some of the stents still end up getting narrow themselves, no, or nagko-close off then eventually. So it could be that the heart is weakening again because nagsara na yung stent na nilagay before, or there could be new or the previously placed stent could be actually open, but there are new blockages somewhere else, no. These are new lesions or these are new blockages that need to be also opened up. Kasi baka yun yung nagko-cause ng bagong weakening ng heart kaya hindi nakaka-pump effectively, and this leads to the swelling of the legs. No? So,
or it could be a different cause, no?
Yes, or it could be
a different.
probably, maybe not, baka pwedeng not even cardiac related or heart related.
Because
So
there are really so many causes.
again, consult is key for these patients, no? So you probably have to bring her back to her cardio, or maybe ask her cardio who did the angioplasty before.
Yes, because it could be veins, it could be kidneys. A lot of my patients actually initially think that they have gout because they have swollen legs, no? Yun pala, pag pina-check mo, they just have a deep venous thrombosis or another cause, venous insufficiency. So it's really good to be sure of your diagnosis so that it can be managed properly. So Doc, from a COVID recovered patient, what lab test do you recommend to check the heart?
COVID recovered patient. Well,
Siguro it depends also on the severity, no?
We don't have routine, what we call routine lab test naman that we order in terms of the cardiac care, no? In terms of cardiac labs. For a patient who recovered from COVID, it really depends on how the patient presents in terms of the symptoms, no? So some patients kasi who have COVID kasi is very let's say it affects all organs almost, no? So not COVID spares nothing, no? So even the heart natatamaan niya, it can also get affected. It can also cause heart failure in some. It can lead to a condition called myocarditis sometimes, no? So again,
Or
this is
inflammation.
inflammation of your heart muscle, no?
Mm-hmm.
So even if there are no blockages in your coronaries, sometimes just the inflammation of the heart muscle makes it weak in terms of pumping, no? So there's also heart failure. So siguro if a post-COVID patient nagkaroon siya ng swelling or ng heart failure symptoms like madaling hingalin or exertional gets short of breath on exertion, siguro I would order a 2D echo or even a chest X-ray to check the lungs, no, if it's congested with fluid, and then maybe some blood test just to
Okay.
check the
Sige.
levels.
So, we're given last 5 minutes for the Q&A. There's so many questions. Let me pick out yung mga pare-parehong mga tanong. In terms of yung what we ingest, no, so is omega or fish oil, what's the role in for cardiac health?
Okay.
Vitamin C?
Okay, so for fish oil, no, we usually prescribe these for patients who have high triglycerides. No? So if you look at your cholesterol blood test, no, it actually has several components. So you have your LDL, which is typically the bad cholesterol, the HDL, which is the good cholesterol, and then there's the triglycerides. It's the triglycerides that are targeted mostly by the fish oil. Okay, so but ito yung fish oil na medyo high dose. These are high dose fish oil. This is not the usual fish oil supplements that we buy from GNC. No, there are actually doses that are more recommended for patients with high triglycerides. And then there's also some benefit for patients who are post heart attack. No, so after suffering from a heart attack, there is some benefit. There are some studies that show some benefit for post heart attack patients.
Okay. What is the ideal level of LDL for younger individuals without diabetes or hypertension? Like me. Ano yung mga sa tulad natin, no, na younger, without comorbids yet? What's the significance of high triglycerides? Diba
Okay.
when we see, they already know that LDL, HDL, may triglyceride.
Yes. Okay. So for LDL, the target for younger individuals with no comorbids, ibig sabihin wala silang mga hypertension, wala silang diabetes, wala silang family history of early heart disease, they don't smoke. Okay, so these patients, we're a bit more lenient again in terms of our threshold for starting statins. Statins is the class of drugs that we use to lower cholesterol, no, particularly the LDL. We're a bit more lenient, meaning we give them the option of maybe trying to do what we call lifestyle modifications muna. So this is where we advocate for exercise, eating healthier, no, and then we tell them now we can repeat the labs again or the cholesterol levels in 3 months and see if you are improving or getting worse or staying just the same. Okay? So only after 3 months kung talagang sabihin nila na hindi nila kaya yung lifestyle modifications, then
That's when you start the medicine.
Giving these medications. But for patients who have comorbids, especially if they smoke, no, for the older patients, these patients by nature have a higher risk na talaga of heart disease and stroke. So these patients, dun kami mas aggressive in terms of prescribing lipid lowering or cholesterol lowering medications. For triglycerides naman, we're actually more concerned with the LDL levels because it's the LDL that is more linked in the studies. No, this is the ones that are more extensively studied and the ones that are linked more to bad outcomes. No, kung mataas yung mga LDL. For triglycerides, not so much. But for very high levels, like above 500, we do give statins first line, and then we maybe need to add fish oil or even the fibrates, no, because these patients na mataas talaga yung triglycerides beyond 500, these are patients who are ano naman, at risk for pancreatitis if we don't
Yes, oo.
bring it down.
Okay, sige. So, some people unknowingly experience abnormal heart rhythms. How do we know if it's completely harmless or when it's life-threatening? Yung mga palpitations, I guess, and the feeling of arrhythmia or irregular heart rhythm.
Okay, so palpitations in the younger people, they're usually not as life-threatening. Okay, so I'm talking about 20s, 30s. So I have a couple of patients who do experience this. They're not life-threatening, but they can be very distressing for the patient, no? Kasi syempre, the feeling of a pounding sensation in your chest, that's very bothersome, no? And then makikita mo yung heart rate mo nasa 160s, 170s when it's supposed to be below 100. So these patients, although not life-threatening, we do offer some medications for them that can help slow down the heart rate. And if not controlled by these medications, then there are some more specialized procedures that an electrophysiologist can do. So ako, hindi ako electrophysiologist. I'm an interventional cardiologist. Doon ako sa mga angioplasty and angiogram. But we have subspecialty training then. People who, some of my colleagues, they do subspecialty training for electrophysiology. So that's where specialized procedures like ablation, no? In ablation, they're able to burn some tissue or even cryo freeze some tissue inside the heart where these abnormal electrical signals may be coming from that leads to the fast heart rates.
Heart rate, okay.
Yeah.
Sige, so some similar questions. What's the main difference between a panic or anxiety attack versus heartburn or versus heart attack in terms of chest pain?
Okay.
How can they differentiate?
Okay. So chest pain kasi that is usually cardiac or heart related. It's typically described by the patient as heaviness. Para siyang diffuse, meaning it's spread out throughout the entire chest. You cannot pinpoint exactly where it's coming from. Parang alam mo lang na parang
Mabigat.
Iba, parang discomfort, no? And it's hard to pinpoint exactly where it's coming from. And sometimes it spreads to the neck, sometimes it spreads to the left arm or the left shoulder, okay? Sometimes even to the right arm or the right shoulder. It's usually, as I mentioned, brought about by exercise or exertion, or if you're going up the stairs or even cold weather. Some patients naman, even after a heavy meal, dun sila, kasi pag heavy meal, doon na pupunta lahat ng blood flow. And then, if you already have clogged coronaries, restricted na yung blood flow going there. So, that's for cardiac, no? For heartburn naman, it's more of sensation. It's hard, no? For heartburn kasi, it usually starts dito sa sikmura, no? So, it's just under the breastbone. Okay? And then, for some patients, may sensation of reflux. So when you say reflux, the sphincter or the gateway to the stomach is not closing properly. So some of the acid from the stomach will end up rising, no? So yun yung reflux na parang naduduwal ka. It goes upwards. You will be able to taste something sour, sometimes bitter at the back of your throat or sometimes sa back ng tongue. So and it's usually worsened if you're lying down flat, no, in bed, especially after eating a heavy meal. So, yung parang hindi siya nagsistay in the stomach, umakyat yung acid paakyat. So, yun yung heartburn naman. And it's usually related to meal intake, not to exertion or exercise. Yung final, yung anxiety attack, this one is a bit more difficult for us internists, no? Kasi this is already bordering into the psych doctor's specialty, no? But for us, we usually see these anxiety attacks in younger patients. Okay, it's those with no risk factors that we can identify. The coronary risk factors that I enumerated earlier, if I'm not able to elicit or not able to bring up any of these risk factors in the patient's medical history, tapos younger patient siya, and then parang hindi siya yung typical chest pain that I described to you now, then we sometimes diagnosis as anxiety attack. But of course, this is what we call a diagnosis of exclusion. Meaning, na-work up mo na yung iba and na-exclude mo na yung more serious causes like your heart attack, your heartburn, no? Or even sometimes lung problem as causes of chest pain before saying na, ano lang to, this is just anxiety attack. And then I can refer to, as I psychiatry.
Okay, sige. So I was told now one last question, but there are many here. Let me just pick this out. So, how can trauma or mental health illness affect heart health? Because that's the title of your presentation. Let's end with this question. And the other questions, CMI will just ask Dr. Abrahan to answer and privately for your benefit.
Okay, so for mental health, as I mentioned earlier, so chronic stress can really take its toll, no? Especially if you are in a chronically stressful environment, no? Whether it be your job, whether it be your relationships, no? Or even the situation like now, no? In COVID. So these situations can, over the years, contribute to build up of your coronary plaques, no? So that contributes towards coronary artery disease. At the same time, pwede rin siyang biglaan. Like if it's a sudden tragic event, it can lead to what we mentioned earlier, yung Takotsubo syndrome or broken heart syndrome. Okay, so these are some ways by which these stressors, no, or even mental health issues can affect heart health.
Okay. Any last words for the audience before we end?
Okay, so again, thank you to CMI for inviting me to speak on a topic very close to my heart, and I hope people were. I'm sorry I wasn't able to answer all the questions, but I hope we picked up some certain key points. No, so primarily about coronary artery disease and heart failure and heart attack. No, heart attack yung I think most important kasi a lot of people really delay. No, the delay is really longest in the patient's decision to call for help or to seek consult. Doon natatagalan. Parang nag-aalangan pa sila. They hesitate. They're afraid to go. Nowadays, they're afraid to go to the hospital because of COVID. No, but those are precious minutes or hours that could have saved more heart muscle or even saved your life. No, kung napaaga sana yung consult, napaaga yung intervention, then we could have done more for the patient sana. So I guess my bottom line is if you are feeling something, do not be afraid to seek consult. Okay, at the
Yes.
very least, teleconsult. No, if you're really afraid to go out. But for the more serious conditions that I enumerated, you really have to go to the ER. Okay,
Yes.
so yeah.
Okay, so COVID is not a death sentence. So I really hope that despite our precautions, despite being scared, let's not make it the reason that no, we die from another cause kasi sayang naman yung life. So that ends our session. Thank you again, Dr. Lauro Abrahan IV. And thank you everyone for attending today's webinar. If you want to reach out to Dr. Abrahan, flashed is CMI's contact details at the end of the session. Again, thank you very much. Stay safe and goodbye.